Well, we can show you the latest COVID data now. There were 189,213 new cases of COVID-19 reported in the UK over 24 hours. 146,604 of those new cases were in England. Another 332 deaths have been reported within 28 days of a positive test, which brings the total number of deaths in the UK to 148,421. Now, the high number of deaths reported on Thursday includes a backlog of hospital death data from the NHS from between the 24th and the 29th of December. On to vaccines. As of Wednesday, there were 11,898 people in hospital in the UK with COVID-19, over 1,000 more than the previous day, the highest total since early March. However, this is still well below the peak of more than 38,000 in January, and the number of people on ventilators remains steady at 868. Vaccines now, 32,607 people have received their first dose, with 43,766 getting their second, which means that nearly 47.4 million people have now received their second dose, and 435,293 new boosters or third jabs were reported in the latest 24-hour period. More than 33.5 million people have now had one of those. Well, let's get more now on the spread of Omicron and what it may mean for the weeks ahead. Joining me now is Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter. Good to see you on this New Year's Eve. We spoke a few days ago. You were fairly positive in your outlook. How do you think things stand right now as we head into 2022?
Whilst we remain positive, and the positivity is due to the booster vaccines that we are rolling out, the concerns are the steep rise. It's the steep rise. It's a very, very sharp incline on the graph of the case numbers. And remember, because we've got a shortage of lateral flow tests, this will always be an underestimate of the true number of cases. And whilst we haven't got more people with serious illness requiring ventilators, they are nevertheless occupying beds. And when they start occupying beds, other things can't happen, your heart attacks, your surgery, your cancer therapies, etc. So for 2022 in January, we are going through a bumpy ride, especially in the National Health Service.
Do you think it's right that the Prime Minister didn't bring in further restrictions? Certainly people in England can carry on as normal this New Year's Eve.
Well, it's almost an oxymoron, really, because on the one hand, we haven't had the restrictions. On the other hand, we are spending money reigniting Nightingale hospitals. So that Nightingale hospitals is telling us something. It's telling us that the National Health Service bed capacity is reaching its absolute limit. And therefore, it would, with infection control, early action, early, prompt, extensive action always saves the day. And we've taken a gamble, and I hope that gamble pays off. I hope we don't have people in car park tents in hospital car parks.
Yeah, I mean, you say that the NHS has reached its capacity, but front page of the Times this morning, no need for more COVID curbs, says NHS chiefs. The head of NHS providers saying the threshold for more restrictions hasn't been crossed. And he's pointing out that serious illness amongst the elderly hasn't risen significantly, which is a very good sign.
It's fingers crossed stuff. And NHS providers will say that, won't they? And so as an infectious disease doctor, I would counter by saying the following. That pulse of infections, that wave of infections, which is now in the younger age group, is traveling upwards to the older age groups. So only time will tell whether the elderly people who are always more vulnerable start to get their infections and become hospital inpatients. Time will tell. At the moment, it is in the younger age group, that pulse of infection, and it is traveling upwards.
Rather worrying to hear that 40% of appointments for booster jabs are no-shows at the moment, because there is this huge campaign, of course, to get people boosted as quickly as possible. And if you book an appointment, really, you should be turning up.
I think so. And this is where our clear messaging is very important. And the messaging is that we have Omicron in circulation. And with Omicron in circulation, it is bypassing your existing antibodies by a big factor. And therefore, you need a booster to have more antibodies to fight off Omicron. And that clear, succinct message is really important, because there are people out there who say, well, I'm fully immunized with 2 jabs. Why do I need a booster? That explanation of why the booster will protect them against Omicron is very important.
And very briefly, your hopes for 2022, where are we heading over the next few weeks?
I'm concerned about January. Then I expect things to start to get better February, March. And also we will have more therapeutics and other things deployed against Omicron. So I'm positive, but I am concerned about January especially.
All right. Well, a very happy new year to you, Dr. Bharat Pankhania. Thank you very much.